Today we're talking about how to grow in quarter 1 using Hospital Indemnity. And we want to get really specific with this. Like I mentioned, a lot of people are setting up talking about what their goals are, talking about how do I grow? Because it's that old-fashioned saying, if you're not growing, then you're actually going the opposite direction. There is no staying still.
Yep.
And I genuinely believe in that. But what I want to focus on is exactly how. I want to give you very specific tools on how to see growth in your bottom line, how to see growth in your bank account, how to see growth and profit starting Q1. Now, this is going to work all year, but it's a great jumpstart in order to get you in the right habits to see a really successful 2022.
Yes, and that's what Q1's kind of all about. So you should already kind of be in the mindset of setting up the new year. Okay, so we're done with AEP. You should be getting your commissions for that soon. And quarter one's all about planning for the next year. So you kind of already have that in your mindset. Yeah.
So starting out with OEP, like one of the big things, are you thinking about what goes on in an agent's life during Q1 and why a lot of conversations around growth? We talk a lot about the open enrollment period. And so some little caveat with open enrollment period is though it is a huge opportunity, it also comes with some limitations, meaning that you can't market with the mindset of OEP. You can't put a big advertising out there saying, hey, it's OEP, come talk to me if you have any questions. But there still is a lot of opportunity to build your business, and there's a lot of, but you also have to be really careful to protect your business. It's definitely a double-edged sword.
Yes, for sure.
So again, we're going to talk about how to use OEP to continue to grow your business in a compliant way.
Yes. And then, so also, the second point here, New Year mindsets. What we mean by that is at the very beginning of the year, people are thinking they have their New Year's resolutions. For the senior market, they just joined, their new plans are in effect if they just enrolled in that Medicare Advantage plan. And so they kind of have their health in the rest of the year on top of mind. So that means that people will be maybe a little bit more receptive, or they'll be able they'll hear you a little bit better about choices that they make in coverage and stuff like that, because they already have their health top of mind.
You're talking to them when they're willing to have a conversation. And that's like how you find the best appointment, is talking to people willing to listen to you.
Yes.
And then last one is exactly what we've been talking about, is AEP 365. So we talk about this again. It seems crazy we just got done with AEP. So why do we want to go ahead and start planning, for what's going to happen 10 months from now? But the idea of that is that if you're going to have a truly successful AEP, you need to have that time of year in mind all year round. So making sure, reminder, who can you call October 1st? The only people you're allowed to call and talk to about their Medicare business, or to actively call about Medicare Advantage, is your current clients. So making sure that you're building up, or anybody who have a permission to contact form with. So making sure that you're building up your list, getting those permission to contacts, getting those new clients with other products, so that come October 1st, you have people that you're ready to go see. And so Hospital Indemnity in Q1, though it seems crazy, we're talking about something that's going to happen in 10 months, is an excellent start to building your AEP list.
Well, isn't it like 70% of most agents' business is done in AEP? It's something like that.
Yeah, it's actually, we're seeing that number kind of switch to where it's a lot more SEP business is done than AEP. So we are, the last couple of years, seeing that transition to where, we're not seeing the last quarter outproduce the first three.
Interesting.
But that is something that's still relatively new. And the idea of it is, again, especially we're talking to clients who have an MA plan, a lot of agents feel like their hands are tied. Like, I can't do anything with this person until October, and then I can't even call this person in October because that's marketing that plan. And so making sure that you're doing right the first 3 quarters of the year, so that you do have the ability to contact those people, and you do have the ability to really see a boom in your Q4 production. All right, so let's talk about, before we get into talking about how to use Hospital Indemnity to grow your business, I want to make sure, and I would love to hear from you guys, of what is your familiarity with Hospital Indemnity. Do you know what it is? Do you know how it works? Have you sold it in the past? If you don't mind just kind of dropping a quick note, letting us know your experience with it. But while you guys are doing that, I just want to do a really quick overview on what Hospital Indemnity is and how it works, and what kind of the purpose of it is. So I recommend, and I would recommend doing the same thing when you're presenting hospital indemnity and you're explaining it to your clients. Remember, stories sell. So you really want to make sure that you are putting them in a situation that makes it real for them so they truly understand, you know, what the risk is with hospital indemnity. So I'm going to actually present hospital indemnity like, Sadie, you're my client. And so I want you guys to kind of see how I explain hospital indemnity to Sadie, my client. Okay. So Sadie, let's just say, again, we're going to talk about, you know, you have a Medicare Advantage plan. You're on this United Healthcare plan. So I just want to kind of walk you through how that plan's going to work in a real life situation. So Sadie, let's just say you're sitting at home on a Friday night and you are with your grandkids and you're hanging out. What's your grandkid's name?
My grandkid's
Yeah,
name?
what's your grandkid's name?
Cade.
Cade. Oh, that's also my son's name. Convenient. You're hanging out with your grandkids, Cade, all right? Now, you and your husband's name, Luke, correct?
Yes.
So you and your husband are hanging out. You have a Friday night. Let's just say you start feeling some chest pain. You know what I mean? You're feeling pretty uncomfortable. What's the first thing you're thinking?
I should probably see something. Heart attack? I don't know what it is.
I have no idea. The first thing I would think is I'm having a heart attack. I have pressure in my chest. That's what I hear most of. So the first thing you're going to do is if that happens, you tell Luke, hey, Luke, I'm having a heart attack, or you think you do, the first thing he's doing is calling 911. So you call 911, and based on what your plan is right now, if you go and you get an ambulance ride, you have about a $300 copay based on the Medicare Advantage plan that you're on. Don't worry about that copay. I have something that's going to take care of that, but just know you're going to have that copay. So you make it to the hospital. Now you're in the emergency room. We all know what that's like. You're in the emergency room, they run some tests and they say, you know what? We don't think you're having a heart attack, but something's really obviously wrong. Do you know what happens to you when that happens?
No.
So they're actually going to put you in something called observation care. Now, observation care is a limbo. It's a huge hole in the Medicare arena. Oftentimes on your Medicare Advantage plan, you actually get zero coverage during observation care. So at that time, you're going to be responsible for anything that happens to you. You're going to be responsible for paying for that stay. You're going to be responsible for the medications at that time because that is kind of a hole in coverage. Don't worry, we're going to get that coverage for you. Let's just say you're in observation care for 12 hours and the next day the doctor comes in and says you're not getting better, it's not a heart attack, but we do see that you're declining, we're going to go ahead and admit you. So you know on your Medicare Advantage plan, if you're in the hospital for 5 days, you have a $300 copay for every single day. So at that point, you'd potentially have a $1,500 out-of-pocket expense that the hospital is going to expect to get. Don't worry about that. I don't want you to not go to the doctor because you're afraid of that $1,500. I have a plan that gives you a check in the mail that pays for every day that you're in the hospital. Okay. That is how a hospital indemnity plan works. Every copay that my client Sadie has, a hospital indemnity plan fills that gap. And that's exactly how I explained that to her. So again, the way that we talk about GTL, that's our lead plan. The way that it works is that for every day that you're in the hospital, you get a check. You can also add additional riders for things like cancer. You can add additional riders for that ambulance ride. And of course, it does cover the observation benefit 100% as well, which again is a huge hole in a lot of coverages offered for both Med Subs and Medicare Advantage plans. It also gives you a check that is designed, or excuse me, that has the client's name on it. So it's not paying the hospital for that, it's paying Sadie, my client. So even if Sadie has funds to cover that hospital stay, or even if she's only in the hospital for 2 days, she still gets that money in the mail, and she can use that money to pay for her claims. She can also use it for, you know, for care for her pets. She can use it, well, I have to recover now, and so can I use that money to have somebody mow her lawn? It's her money. She uses it however she wants. So any questions about how the hospital indemnity plan works? It's genuinely designed to make it, give them a check in the mail for every step of the way of them receiving care. And the biggest thing I'll say is, how many people do you know that will not take an ambulance ride because they don't know what it's going to cost them, or they're afraid of the cost of going to the hospital? They're afraid of that access to care.
Yes.
So I want my clients to, if they're sick, go to the hospital. If it's an emergency, use the ambulance. The last thing I want to stop them from seeking care is cost. On a Medicare Advantage plan, so many times that's what stops your clients from actually seeking out care. Because
Yes.
not even because it's a lot of money, but they don't know off the top of their head how much money.
That's what's so scary is like you hear jokes, like you kind of joke around like, oh, I'll call an Uber, or oh, I'll just drive myself, or something like that. But in a situation like this, obviously you'd want, you know what I mean?
Yeah.
It's like this is life or death.
Mm-hmm.
And so if they have that security, knowing that they don't have to worry about, you know, or like they
Right.
know how much it's going to cost, they don't have to worry about that burden, they're going to get the care that they need. And you know, sometimes it does sound kind of crazy to think, well, if someone's having a heart attack, like they're not, you know, they're not going to hesitate.
No.
I mean, come on.
No,
Yeah,
it happens
it's like
all the time.
all the time. Yes. So
especially in your rural areas. And I'll say one of a really close friend growing up of ours, their dad was in a rural area. He started having this exact same situation happen, started having chest palpitations. He insisted his wife drive him to the hospital, and he died on the way there because he did not want to get an ambulance. He felt silly getting an ambulance, didn't want to pay for it. So again, there's just so many things here. That's how it works. We'll go ahead and move on, because what I want to talk about is exactly what we mean. Now, this webinar is entitled Growing Using Hospital Indemnity, but we've actually broken this up into two ideas. We have growing and gaining, because the bottom line here is, how do I get more clients? How do I get more money? How do I get a more secure agency? And how do I grow how much money is in my bank account? And so you're going to grow your profits by growing and gaining. So this is exactly what we mean. What do we mean by growing?
So growing is the first thing that we're going to look at, obviously. And whenever we talk about growing, we're specifically talking about dealing with current clients, retaining the business that you already have, not worrying about necessarily right now. We'll get to it in a second, of gaining new clients, but we're looking at our current book of business right now. And why we say that is because if you look at the first point here, it is 6 to 7 times more cost effective to maintain your current clients than to bring one on. So this is an industry where we are very lead hungry, which is totally okay. That's totally fine to spend time looking at your leads, working on your lead process.
Well, I hear growth, and I think more people.
Yes.
That's where, when I first hear the growth, I think, how do I get more people in my database? Not necessarily how do I make the most out of my current book of business. And I think that's a really important kind of mental mind switch.
Yes, but what we see is that, like, statistics show, there's studies, I can't remember the name of the study, but there is that study where it shows that the more products that someone has with you, the more loyal they're going to be. That's just proven. And so you're able to grow your account, you're able to grow your business quicker and more cost effectively if you are working with the people that you already have, and you're adding products on to the people that you've already brought on. You've already built a relationship, there's already that loyalty. You don't have to worry as much about going through the whole process of bringing someone on, which is a process. It's a whole thing.
Well, whenever you're bringing on a new client, you're selling two things. Number one, you're obviously selling policies, but number two, you're selling your services. You're selling why to work with you versus Joe Schmo or Joe Namath even. And so whenever you're bringing on somebody who already has a policy with you, then you don't have to sell yourself as hard. You get to spend more energy looking at additional product lines. Now, this is what we talk about here, is turning policy holders into clients. Reminder, a policy holder is somebody who has one product with you, be it a Medicare supplement with a PDP. I would consider that one product, or somebody with a Medicare Advantage plan with you. There's like Sadie, I said Lacey, like Sadie mentioned, there's actually, if they have one product with you, about 33% likely to keep you as a client. They have 3 or more, that jumps up to over 98%. So making sure that you do, and that's a LEMRA study that was done back in 2012. That is something that that we really push a lot about. But what you have to do is, again, reminder that it's totally okay if your current clients say, no, I don't want a hospital indemnity plan. They hear you put them in that situation, you tell them Sadie's story, and they say, no, I really don't need a hospital indemnity plan. I have a bank account set up. I really don't want to add more funds to this. That's fine. But at least they know it's an option. So when someone else brings it up, it doesn't make you look bad for not bringing it up. So it's okay to hear no, but they just need to make sure that it is an option.
Well, also during OEP, like we just talked about, it's kind of, it's a time where people are trying to I'm going to use the word steal other people's clients, and also protect their own. So if you're offering one and they say no at that time, you're also protecting yourself from another client offering it, or another agent offering it to them, and them saying no because they know they can get it through you and they already have that other policy.
We're going to teach you how to steal other people's clients using Hospital Indemnity. So make sure you're not letting your clients be sold this way.
Yes.
Also keep in mind, we talk about this a lot. It's a great retention method. Sadie mentioned that, but it's also like the best for Q1 AEP post appointments. If you don't have AEP follow-up appointments, you're really doing yourself a disservice. During the AEP follow-up appointment, people are really excited to talk to you because you're teaching them how to set their dental benefits, how to use their dental benefits. You're teaching them how to use the gym membership. You're teaching them how to use the over-the-counter membership. If you have a ton of clients and you just can't possibly like do a follow-up appointment for all of them, these can easily be done over the phone or with a staff member as well. But during that appointment, all you have to say is something like, you know, hey, a lot of my clients, you know, thank you so much, Sadie, for sitting down with me. We went ahead and reviewed your benefits and you got your cards, everything set up. I did want to let you know, a lot of my clients who are on the plan that you're on have voiced that they're really concerned about this, you know, $3,900 max. And so I wanted to bring this up to you because if other people are feeling that, I wanted to make sure that you're not feeling that. But if you are worried about that, I'm telling my clients to join this hospital benefit or to get this hospital benefit. It really takes care of that cost. So if you are concerned about that, let me know. We'll get you something taken care of.
Yeah.
That is how you bring up Hospital Indemnity in a follow-up appointment. Follow-up appointment or follow-up phone call. Either way, it's easy. Just saying, hey, other people in your situation have voiced this. Let me know. I'll help you take care of it. Yep. And then last but not least, again, making sure your current Hospital Indemnity clients know to change without letting you know. Now we have those programs. Is anybody on here familiar with AMP, Agent Marketing Portfolio? If you've used it, you're familiar with it, let me know. If you've not ever heard of it in your life, you're like, girl, what are you talking about? Also let me know. But AMP stands for Agent Marketing Portfolio. It is something offered by senior marketing specialists. We have compliant cards, postcards, letters, flyers, everything that you send out to your current book of business, just like a one-off contact that you send them. And it basically says, like, if you have questions about your hospital benefit, call me, I have something. So even if you don't give them everybody individual phone call, you can still send out letters to your book of business to let them know, like, hey, this is an option that a lot of my people have questions about. The biggest thing here, we've talked about this, in OEP, not only are you trying to gain business, but you're really trying to protect yours. Yeah. So if you have a client that says, with a Hospital Indemnity plan, the best thing to tell them is like, hey, if you have questions about your plan, keep in mind, Sadie, I have built you a full, holistic, comprehensive package. So if you change something on your Medicare Advantage plan, it can throw off everything else we have set up. So if you're thinking about changing plans or you have questions on your plan, call me first, because I want to make sure your package takes care of you holistically. So if you're thinking about making changes, I need to be your first call.
Yes.
Get that extra little line of defense there.
Yep.
Any questions on that, guys? Again, this is how we're talking about growing, making your current book of business work for you. They already trust you. They're much more likely to buy from you. We don't have any questions on that. Let's go ahead and go into gaining. And Sadie, what do we mean by gaining new clients?
So gaining means gaining new clients. That just means we are adding people to our already growing business, right? So we're already growing with our current book, and then gaining is just adding new people on. So these are going to be your leads. These are going to be people that are new to your business that you have not sold to before.
So the biggest thing where people asking, like, how do I grow with OEP? Number one, continue your normal marketing system. Yeah. If you're buying leads, keep buying leads. If you're doing Facebook, keep doing Facebook. If you're doing seminars, keep doing seminars. That doesn't change because it's Q1. That doesn't change because it's OEP. However, you know, so continue, but I want to keep in mind, it is a Hospital Indemnity plan is an excellent way to get your foot in the door. So maybe, again, we'll talk about this on the next slide, but changing what types of leads that you're doing and making sure, let me give you an example. We're seeing a lot right now when you're doing those lead drops. You come across somebody who has a Medicare Advantage plan. Well, maybe they are happy with their plan. Maybe they don't want to change or something the case. That's not a wasted lead. That's an opportunity for something else. So I'm talking to Sadie, and Sadie's like, you know what? I'm on my Medicare Advantage plan. The question we're going to ask her is, okay, perfect. So you're using Humana for your Medicare Advantage and your prescriptions. Perfect. Who do you have your hospital benefit through? And Sadie's probably going to say, either she's going to say hospital benefit, what's that? Or she's going to say, well, I just told you I have Humana. And it's no, I understand, but that's your medical side of things. That's, you have some hospital coverage in there, but the extra benefit that you can get, do you not have a hospital benefit right now? Your agent didn't tell you. So what are you going to do if you go to the hospital? How are you going to pay for that? Have you discussed or figured out how you're going to pay for your hospital stay? Thank God I'm here to help you cover the hospital stay. All I did there was one, I put a ton of doubt in Sadie's mind about her previous agent, because I'm saying, you don't know about this? What do you mean you don't know about this? I'm making her other agent look bad. Number two, she is now, once I get her the hospital indemnity plan, she is now a client of mine. What does that mean? I can now advertise to her and call her to talk about Medicare Advantage come October 1st. I can also, because she is an AEP client, I can now talk to her even more invested into open enrollment and let her know that, like, hey, there are other options for you. Why? Because I'm not marketing to her using AEP. I'm not marketing to her using OEP. She's a current client of mine now. And so all I'm doing is taking care of a current client. The rules are very different for marketing MA, current clients versus new prospects. So what we're doing is getting her to become a client using hospital indemnity, which a lot of times is no underwriting between the ages of 64 and a half and 65 and a half. So you're not worried as much about underwriting. Super, super easy, super affordable. We're talking between $20 to $60 premiums, depending on how pimped out of a plan they get. And it's very low. It requires a low trust barrier because it's all right there in front of them. So get your foot in the door using hospital indemnity and asking them. And it's really easy to make an agent who didn't offer that look bad.
Yes. And even if they say no at the time, you're going to be top of mind for them whenever AEP rolls around, because they're going to be like, they're gonna keep in mind someone who, well, this agent kind of helped me out. And then whenever if they join you with a Medicare Advantage plan that next AEP, you can just then you can kind of make that comprehensive benefit package. Yes, you can get both of those products all in one shoot. So even if they say no, it's still not wasted. You've still instilled that distrust in their current agent, and that will prep you for the AEP.
Absolutely. Now, keep in mind, when we're talking about hospital indemnity, I do really like hospital indemnity led lead drops. I'll tell you my least favorite lead to order is a Medicare lead, because not only, like, people get so many Medicare branded things, especially people turning 65, get so many Medicare branded things, they throw it away. It makes them numb to it. So I like my lead drops, to order them for the stand out, I stay away from the topic of Medicare. So I do a ton of lead drops of talking about, like, dental, vision, hearing. Dental, vision, hearing does have the highest return, but I like hospital indemnity branded lead drops. Hospital indemnity, and you never say indemnity, you say hospital benefit, because nobody outside of, like, this group of people knows an indemnity plan is. So stick with hospital branded lead drops. I know we talk about lead concepts. Lead concepts has great mailers specifically geared towards hospital indemnity. You just have to make sure you can sell holistically. So again, when I'm talking to Sadie, I'm going to say, hey, Sadie, I know today I'm here to talk about hospital benefits, but I just want to let you know I take care of my clients holistically. So we're going to look at your entire benefit coverage today. I know we're talking about hospital indemnity, but in order for me to do my job, we're going to look at all of it.
Yes.
So get your foot in the door with a non-Medicare product, earn that trust, set the expectations, and then you can take the entire business.
Yes. I think that's huge, actually. I just want to hit on that really fast. I think that's huge. Setting up the expectation that you're not presenting it in a way of saying, hey, I'm going to take care of you holistically. I'm building you a comprehensive benefit package. That's kind of the sort of phrasing. Offering it that way, one, it kind of helps them. Well, actually, I was about to make a point that we'll get into here in just a little bit, but it shows that you're not just trying to, it's not coming right out and being like, give me your money. Right. It's showing them, it's proving to them that you are offering them something that's going to cover them holistically. You're looking at it and you're customizing their experience to what they need. And also that kind of helps set up their expectations for other ancillary products as well. But it really helps kind of drive home the point that hospital and that Medicare Advantage is still left bear without. Like it needs to be
It
paired
needs to be
together.
something.
Yes.
You know, it's like going to a doctor's office. If I go to a doctor's office because I have a headache and that doctor says, you have a headache? Okay, take Tylenol. I'm less likely to return to that doctor versus I go to another doctor, say I have a headache, and he says, okay, tell me your family history. Tell me what else is going on with your life right now. Tell me about your stressors. You know, here is something holistically to take care of you. As headache is a symptom, but let's figure out what's really going on with you. That's exactly, if you're an agent that's just pushing MA, just pushing med subs, you're the same kind of doctor who only prescribes Tylenol.
Right.
So making sure you are taking a very holistic approach and setting those expectations help you do that. So if you are into lead drops and you're wanting to really gain and do a quickly gaining of new clients, lead drops is an excellent way to do that. Stay away from Medicare lead drops. Get into some of these ancillary ones. Part 2 of that is just to continue to ramp up your educational sources. Social media being one of them. I love doing not Facebook Live. Yes, it is called Facebook Live. So I was going to say FaceTime Live. I'm confusing all of the medias. Facebook Live and doing little things of like, hey, so one Facebook Live that I would do is, hey, I just got off the phone with my client and talking to them and they were getting ready to use their plan or talking about their plan, but they mentioned that they were really nervous about going to the hospital because of these copays. They're not big copays, but anytime a client tells me they're worried about going to the hospital because of my income, then I'm not doing my job right. So I advise that this client get a hospital indemnity plan and work on their hospital benefit. You know, that's an excellent Facebook Live. Saying, I had another client express this. I wanted to share that experience with all of my friends. So there's an excellent Facebook Live content for you. And also continue to do seminars. I love a seminar that's like, what's it look like when you go to the hospital? A great seminar for that. It's great because you're talking about hospital indemnity and you're talking about home health care.
Yes.
All in one package, but you're doing it as an educational seminar to say, here, I want to make sure you're aware of what to expect if you have to use your benefits.
And it draws both current clients and potential new clients as well. It's for everyone.
Yes, it is a perfect retention practice and the best acquisition practice.
Yes. Also, we don't have this on here because we kind of get into it a little bit more tomorrow, but another one way to offer hospital indemnity plan that we really, I should have put this on the slide, I didn't, because this is a really important part. Make sure that you're choosing one carrier and you're offering one carrier. The less options that they have to go through, the easier it is for them to say yes or no. So contract with one carrier. Tomorrow we'll get into the reason why we suggest GTL. But also there's other, we'll have the outreach team talk with you and maybe there's something else that works better for you and your process and all that sort of stuff. But we highly suggest GTL. We'll get in that tomorrow. But again, all of this, I'm rambling. I digress. If you offer one hospital indemnity plan, then you're asking them, do you want hospital indemnity, yes or no? Not, do you want hospital indemnity? Yes. Okay, great. Now let's go through all these different carriers and now you have to choose which benefits you want.
And then, let's go through the carriers. Let's go through the benefits.
Let's
go through the premium. And I expect my experts to know, like, which one do I pick? Again, bringing it back to doctors. I always go to doctors because I think they're really smart and people respect them for the most part. So like if a doctor again, isn't going to say, here are the brands of medications you can choose from. They're saying, no, I'm going to prescribe you this medication. I expect my doctor to do the legwork.
Right.
Now I can choose yes or no. Do I want to take that medication? That's just their recommendation. But I'm not going to say, do you have any other types of brands? I'm going to what my doctor recommends, I'm going to do.
Yes. And it also, makes it easier for you. You don't have to, we just talked about yesterday, there was an example given to us that there's a few agencies here where it makes it easier for their downlines to also offer it as well, because you go in their supply room and there's a hospital indemnity section and there's one carrier. Their agents don't have to go through, the agents don't have to worry about it. So it makes it easier on your part as well.
Keep it simple. So we have completed today's webinar. If you have any questions, comments, concerns, thoughts, or promises, let us know. Sadie and I are going to hang out here for a little bit longer to answer your guys' questions. But I do recommend, again, if you don't have GTL, make sure you hang out and watch the webinar tomorrow with Sadie and Clayton. If you do have GTL, is anybody here writing GTL? Are you familiar that they came out with a brand new plan like last October called their Elite Plan, which is essentially what their Elite Plan did is allow you to offer more benefits to your clients for an even cheaper cost. So if you thought you knew GTL, give them another look. They came out with a brand new plan that has really taken the industry by storm.
Yes, for sure. They were the first to do this, right? They were the first
They were
in the hospital indemnity.
They came in early and hard on
Yes.
hospital indemnity. They launched it back in about 2007 or 2008. Have never had a rate increase on their stuff. In fact, they've had rate decreases. Have reworked the product about 3 times now, which is, you know, and every single time they rework it, it's better and better and better.
Yes. And then also, if you want to check out that AMP program that we talked about, you can find that on our website. I'll also have it linked in the follow-up email as well. But if you're a contracted agent with us, I mean, yeah, you got it. And so all you have to do is pay for those printing fees. It's all personalized, so you don't even have to worry about customizing the whole thing to yourself. It's already done, compliant, all that good stuff. All you have to do is add your name and information. So it's super easy, really, really awesome tool available to you if you're contracted with us. So keep that in mind.
Awesome. Well, we appreciate you guys hanging out with us today. We hope to see you tomorrow. If you do have any questions, obviously call our office, 1-800-689-2800. We really hope to see you take into account and start offering hospital indemnity plans, making sure that you are building holistic benefit packages for your clients. Awesome.
Yeah, thank you.
We'll see you next time, guys. Thanks.
Thanks.